Being a yoga teacher means Sarah was used to being flexible, until one day she found herself in so much pain she ended up in A&E.
One morning I was bending down to feed my cats and something snapped and I couldn't move. And I got taken to hospital because it was that bad. And what had happened was I had a sort of a liquid tumour around one of my vertebrae and it smashed my vertebra.
The 48-year-old from Falkirk actually had myeloma, a form of blood cancer. Her treatment is going well and she hopes to get back to work soon. While the nature of her condition makes it difficult to spot early, increasingly late diagnosis is becoming more common for other cancers. While we're all told that the earlier cancers diagnosed, the better, a study for Cancer Research UK showed that more than a third of people with the disease were only diagnosed after coming to A&E departments, like the one here at Forth Valley Royal.
What we know at the moment is that the capacity and the workforce in the NHS in Scotland for those cancer tests, those cancer diagnoses, have a lot of gaps in them. That's been there for a number of years, and until we address those, it's going to be difficult to reduce the number of emergency presentations that we're seeing.
And charities say the impact of late diagnosis on patients' daily lives can be huge.
Overall, around 60% of patients who have had a delayed diagnosis report a serious impact on their mobility. And then when your mobility is compromised, your quality of life is compromised, and that can also affect your well-being more generally.
The Scottish Government says while the NHS is still under big pressures from COVID, it's invested £20 million to help improve early detection of cancer. Vanessa Kennedy, STV News, Falkirk.